this week's Cardiology Countdown, we have 2 new treatments for metabolic syndrome and a new approach potentially to deep venous thrombosis. So at the number 3 spot is a paper published in JACC Imaging that looks at the very detailed analysis of the effects of aldosterone antagonism with spironolactone on patients with metabolic syndrome. They did color tissue Doppler imaging to look at measures of diastolic function, overall LV function, and then also did fibrosis markers. And it did a randomized study in a little over 80 patients looking at the benefit over a 6-month period. And what they found was improvements in LV function and diastolic function, as well as reductions in the markers of fibrosis with the addition of spironolactone on top of ACE or ARB inhibition that was used in all patients. So this is a very interesting mechanistic study that offers further insight into the benefit of aldosterone inhibition, one very underutilized therapy that we should think more about using. At this week's number 2 spot is another unusual treatment for the metabolic syndrome, CPAP. There's a study published in the New England Journal that looked at patients with metabolic syndrome who were obese and had evidence of sleep apnea and did a randomized crossover study and found resolution in almost all the parameters of the metabolic syndrome with improvements in the lipids, both LDL going down and HDL going up, triglycerides going down, and improvements in glycosylated hemoglobin as well. And they found that with effective CPAP therapy, they found 13% of patients resolved completely their metabolic syndrome. And so a very intriguing additional benefit, and might explain how, on the one hand, sleep apnea has been related to bad cardiovascular outcomes, and how therapy therein may be beneficial for cardiovascular outcomes. And at the number 1 spot this week is an intriguing study looking at thrombolysis for deep vein thrombosis. This is something looked at a decade or 2 ago, but looked at very carefully in a randomized trial published in The Lancet, about 200 patients, where they found improvements at 24 months, so long-term outcomes, in reducing the post-thrombotic syndrome that is often a complication of deep vein thrombosis. So the thrombolysis did have some bleeding complications, but just 3 out of 100 patients had a major bleed. There were no deaths related to the thrombolysis. And so the authors offer this as potentially a new treatment that could improve patients with large iliofemoral DVT. So for this week's Cardiology Countdown, I'm Chris Cannon.